join in. So making a little bit of a start. So welcome everybody. My name's Lucy. I'm founder of Baby Week, and this is the 5th Baby Week. This is co-run with lots of different professionals, and many thanks to Sadia Salim, and who is operational lead and representing Child Friendly Leeds here. This year, obviously, it's very different. We have had a fantastic full week of a lot of digital events. The theme this year is stay safe, stay connected, and usually the last 4 years we've been at the marketplace, and everybody like literally the Kirkgate market with the stalls and everything. So all of these professionals that are here on the screen now, usually at this point in time, are setting up their stalls to meet people face to face. But this year it's a little bit different. So this year we're having a Q&A webinar, which you've all come to, and so I'd like to just introduce, before we start the questions, we have some pre-questions that have been given to our professionals. So I'm just going to introduce the professionals to you now briefly, just by reading out their names. So we have Laura Walton, who is the lead midwife of maternity strategy for Leeds Teaching Hospital. We've got Katie Cavell with her, who is team leader, community midwife and continuity of care. We have with them in that room, safely socially distancing, Phoebe, who's a student midwife, and Nada, who is a rep from the Hamler Midwife Service. We've got Sally Goodwin-Mills. She's Advanced Health Improvement Specialist for Infant Feeding for Public Health. We've got Liz Wigley from Maternity Commissioning, from Clinical Commissioning. She's Maternity Commissioner. We've got Sarah Cook. She's the 0 to 19 Clinical Change Lead. We've got Suzanne Tobin. She's Breastfeeding Peer Support Coordinator. We have Amanda Jackson, 0 to 19 Clinical Lead Manager, Single Point of Access, Health Visiting, Postnatal in the Community Outreach for the 0 to 19s, Public Health Integrated Nursing Service, which is FINS. We've got Helen Hayward. She's a Maternity GP. We have Liz McKenney, neonatologist, and Maria Kaisoff, perimental health peer support worker. And yes, I think that's everybody. And myself, Lucy, and Sadia as well. Okay, so we are going to go to the first question. So the first question is, how do you recommend feeding a tongue-tied baby who's waiting for a frenectomy without experienced weight loss plateau? You can tell I'm a lay person here. I've got no clinical medical qualification. So we shall put that to Suzanne and Sally. And if you just want to introduce yourself as well. Thank you.
Hi, everyone. Morning, and it's lovely to see you here. I know a few of you know me from the Leeds Bosom Buddies service, or my lay counsellor role within the LH League as well. Been doing this around 15-16 years now, but yeah, it's lovely to see everyone today. And tongue tie has kind of been more of an issue in terms of services wise throughout the pandemic, but thankfully since August, the fabulous infant feeding team, who have been absolutely great during the pandemic as well, who were doing home visits up till then, they were able to recommence their service, which has reduced down the waiting lists in terms of being seen. You may not know, but tongue tie division, or the frenectomy, is an aerosol generating procedure, which is one of the higher risk procedures with COVID-19. So that is why it became such a difficult time to access it in the initial stages. In terms of what we can do, kind of some of the time babies are putting on weight fine, there's no plateau, but the feeds are still very, very difficult. There's a lot of things we can do in terms of positioning. This is Griselda. You'll all know her from a Wednesday session, but in terms of positioning, it can be sometimes a kind of a supported hold, so a really big C shape can give stability, and this holds the breast in the mouth, and can mean that there's less pain for mum during this, and that baby stays on a little bit more, and also an exaggerated latch position. And all of you professionals can help guide you through this in terms of doing that. Where babies can't latch on, often many mums find they do need to express during this as well, but what we would say is keep getting that specialist help. And I know there's a lot of questions today, so by all means parents kind of, you know, I don't want to spend too long on that, but I hope that answers some of the questions behind that.
Would anybody else like to answer that question from our team? Okay, what are the options for having babies weighed safely in this second lockdown, and how do parents find out about these? This goes to our not to 19s, or Helen, or
I can take that one. It's Amanda Jackson. Hello, everybody. My name is Amanda Jackson. I am one of the clinical team managers for the 0-19 Public Health Integrated Nursing Service. You might know us a bit more familiar here. We used to be called health visiting in school nursing. So yeah, brilliant question, Lucy. It's one we've been asked quite a few times recently. Just to give a bit of background in terms of weighing clinics, to follow the national guidance and in order to be able to keep everyone safe, we've had to look at ways that we offer our service at the moment. We've currently got virtual clinics running where families can book time and speak to a member of our team about topics such as breastfeeding, weaning, sleep, behaviour, potty training. And we're also offering extended hours currently, which is our telephone service where you can speak to a 0-19 public health integrated nurse. You might know them again as health visitors, between the hours of 5 while 8, so that opens up our opening times. I want to reassure people that, you know, we have been offering and we continue to offer weight reviews to some babies. This is following a clinical assessment with one of our public health integrated nurses, and that's on a one-to-one basis. And if anyone would like to speak to the named nurse, you can just get in touch with us on our contact number, which is, just in case no one has it, and I'll read it out a couple of times. It's 0113 84 35 683. And I also want to kind of reiterate, there are lots of ways other than weight to tell if your baby's thriving. We often talk to parents and ask them questions such as, you know, do your little ones look, smile and follow their caregivers? Do they start to put noise and quiet voices? Are they developing and interacting? You know, you're getting things like smiles and I suppose feedback from them. Are they feeding well and frequently? And are they filling the nappy? And if any parents feel like they could do with a bit of a conversation about these points, we know more than happy for them to chat through about them being responsive to their baby's needs through any of our virtual clinics. So, okay, Sarah, I don't know if you want to chip in at all, or
I will. I'm Helen Hayward.
Hi, Helen.
Hi. So I'm Helen Hayward, a GP. Just to add to that, practices, so general practices will each be taking their own decisions about risk assessment during the pandemic, but nonetheless, of course, baby immunisation is an absolute priority and is continuing. So for that, of course, babies have to be brought to the practice at the 8-week mark for their first immunisations. And certainly in my practice, and I believe in most practices, we're trying to combine the usual 6 to 8 week developmental check of babies at that time. So that is usually done by a doctor, can be done by a trained nurse with the right competency. And part of that often will be weighing the baby. I know sometimes previous experience might be that the weight has been done ideally elsewhere, or perhaps it isn't even necessary, and an assessment will be made around that issue. But certainly all general practices do have access to baby scales and can and will weigh if necessary.
Thanks, Helen. And I suppose just to reiterate that, you know, we want to support families at a time when we can't routinely weigh, as Helen was saying, but we also want to reassure you, you're the expert on your baby. You know, we're here to listen as our GPs and other professionals. And if you are worried or concerned, routine weighing isn't always a helpful measure in terms of detecting any, you know, significant issues. And it's only a small part sometimes of your baby's progress. You know, we want to be able to support you. You know, all parents, family members help babies grow through being loved, held close, being calm and responsive, given time and attention, and babies being, you know, responded to. So if you've got any worries or concerns, please get in touch with, you know, the public health service, your health visitor, or like Helen was saying, the GPs as well. Thanks, Lucy.
Wanda, thanks, Helen. That's really good, important information. And don't worry, everybody, we will be publishing this on our website after. Another question, slightly different. What are the good ways to stimulate baby at home? And with so many baby groups closed, some ideas for baby play would be good. Who would like to answer this? I know we've got a past family outreach worker there, and we've got, we may have something from Amanda again. Just put your hand up, just take your microphone off if you want to add to this.
Yeah, I can start. So yeah, I've been working for the perinatal mental health service just for about 4 weeks, but prior to that I was an outreach worker. Yeah, so some different activities that you can try at home. Black and white is really good for quite young babies, just to stimulate them. Reading, singing, sensory play, using bubbles, going for walks through sort of woodlands and things, and letting them look at the sort of light and the leaves moving and things, and listening to birds, dancing, music, playing peekaboo, are all really good ways to sort of stimulate your baby, and bond with them as well.
Thank you, Marie. Also, we will be promoting our 50 things as well, 50 things to do before 5 as well app, and just making sure that obviously it's very relevant to the current situation, that we do find exciting and innovative activities to do with your children. The next question is, what antenatal and perinatal services are currently available for partners and dads, please? Marie, would you like to answer this as well?
Yeah, so in part, you know, sort of because of lockdown, we've had to do things quite differently, and we're doing a lot of things via Zoom. So our service is still offering groups. We've got about 8 groups that are running at the moment. So there's a sibling support group, we have an antenatal group and a postnatal group. We have an arts and crafts group, creative writing, baby massage, as well as continuing to do urgent referrals, normal referrals and assessments. We are still doing some face-to-face visits in full PPE, and we're also telephoning women that are struggling, and also the fathers. There's a partner support group for the fathers, because we identify that when mums are particularly struggling with their own mental health, that does have an impact on the fathers as well. So yes, we're doing lots of things via Zoom. We also have a resource booklet with information, just sort of telling you different books that you might be able to read, podcasts, and I'm currently just looking at that and trying to update it, and it might be that after this call I'll be able to email that to Lucy, and she'd be able to sort of share that with some of the parents, if they feel that that would be beneficial.
Thanks, Marie. So I've got a strange cat doing something weird. Thank you so much for that. And would you be able to share that, and we could put that up as well for results?
Yeah, absolutely. Yeah.
Okay. Great. I just want to say thank you to all the professionals here that have taken the time to join today. This is a new thing. We've never really done this before. So I think this is kind of the way that we are looking at in the future. And I'd also just like to say welcome to all the participants that have joined. It's lovely to see a baby in the room. Feel free to add your questions on chat. We've got a few more questions that have been pre-asked that we're going to go through, and then we will open it up. The next question we have, what is the trust policy on allowing patients and birthing people with hidden disabilities support from their partners whilst in hospital? Are they willing to listen to the impact this is having on patients? I think this is one for you, Laura, and the team at Leeds Hospital Trust.
Hi, I'm Laura Walton, one of the lead midwives at Leeds Teaching Hospitals. And I think really what we want to reassure really with this is that we are listening, and we are aware of the impact that the visiting restrictions are having on the pregnant population of Leeds. We would like nothing more than to relax the restrictions completely and allow everything to be back to normal. But unfortunately, this COVID has got a different agenda to what we have, and we have to follow national guidance and ensure the safety of everybody, of the pregnant population, their families, and our staff. And I think we are, in reassurance to this, we are patients with hidden disabilities and physical disabilities have reasonable adjustments put in place for their visiting and their needs within the hospital. So if anybody does have any physical or hidden disabilities, please discuss this with your midwife, and an individual plan will be put in place involving reasonable adjustments.
Thank you, Laura. Thank you very much. We'll be coming back to you again soon. But the next question is breastfeeding, infant feeding, regarding the GPs and their training for giving advice on breastfeeding. This came up at a Wednesday's Bosom Buddies Big Latch On event. The question came up, and what is the knowledge on what medication to administer pregnant or breastfeeding? So that's quite a kind of like a two-pronged question there. Sally, would you be okay with this?
Yeah, absolutely. Thanks, Lucy. And I think, yeah, it's a really good question. And as the strategic lead for breastfeeding in Leeds, it is one of my roles is around ensuring that practitioners have the right training, have the right information, and have the right referral routes to ensure that everybody has the correct information to support breastfeeding mums. GPs are exactly that. They are general practitioners. Very few of them are specialists in breastfeeding support. So what we ask is for those GPs who perhaps are not familiar with perhaps the medications or what have you, like with other things, they will look it up. They've got resources that they can look things up for. They have contact details of people who can support them. I do provide training, I have provided face-to-face training in individual practices where this has been possible. I've also attended this year, in fact, the target sessions, which is training sessions that GPs attend every month. I think it's every month, on different topics. And I did do a session on breastfeeding and medication. But as I said, like with everything else, you know, if you're not practicing this all the time, it's not going to be, you know, at first hand sort of thing. So it is about making sure that people have got the right resources and the right information to be able to access. So yes, a lot of it is about communication. Yes, there will be situations where perhaps GPs aren't aware and perhaps the communication has got lost in places, but we are, you know, I really want to reassure people that we do our best to ensure that information is available for GPs and that they can access it freely. I don't know if Helen wants to add anything, because Helen was at the target sessions I did earlier this year.
Oh yeah, they were fantastic. Thank you very much. Yeah, we enjoyed that target session. Target, by the way, stands for something like training and guidelines and so on. So yeah, absolutely, as you say, we always want to consider what medication we're prescribing, particularly during pregnancy as well as breastfeeding. And we don't have it necessarily at the top of our head and our fingertips. Certainly in the majority of women we see are not requiring medication, and so it's not a consideration, but when prescribing it should always and is always a consideration. And of course some women are on a number of medications, and we always take that into great consideration, and always the risk and the benefit has to be weighed up to both the mother and the baby. But we absolutely would cross-check at the point of prescribing, really, and look at resources if we've got any doubt. And if that's still not clear, particularly sometimes when trying to balance up that really fine line between risk and benefit, we might seek additional advice, for example, from the perinatal mental health service specialists or other specialist colleagues, if there was a particular condition that the mother, for example, was on regular medication for. You know, it could be anything really, couldn't it? I'm just thinking of patients that spring to mind, somebody with Crohn's disease, for example, or rheumatoid arthritis, or there's any number of things. So it can be a real tricky decision, and it can be a difficult one for us to make, but we absolutely will call upon resources and specialist colleagues if there's any doubt. Patients and people seeing us shouldn't hesitate to ask and to question. That's one thing I would always encourage all patients with their prescription medicines, is to try and understand them as best they can. So what have they been prescribed them for? Is the doctor aware of other things I might be taking from other places? And please don't hesitate to ask those questions. And if you've forgotten during the consultation, come back to us and let us know, and write it down if necessary if you think you're going to forget.
Thank you, Helen. Thank you, Sally.
Lucy, can I just add to that as well? We've now kind of progressed to where we've got some brilliant national resources as well that GPs and parents can tap into if they're unsure. So for many, many years, we've got the brilliant Wendy Jones at the Breastfeeding Network, and most of that information is on the clinical knowledge skills framework that the GPs can access. We've got the brilliant GP Infant Feeding Network now, who are doing excellent things, in Hospital Infant Feeding Network, and they have the campaign that says "Don't say stop, look it up," and we have the UK DILIS, which is the specialist prescribing service, where if GPs or other health professionals are unsure, they can go back to them, and often the turnaround is the same day or the same or the day after. There's almost always an alternative if something isn't safe as well.
Thanks, Suzanne. That's really good information. And the great thing about this is that it does get a chance. This is an opportunity not only for parents and carers to speak to the professionals, but it also gives a chance for the professionals to find out from each other, what's actually happened. It's really good to share that knowledge. Thank you. Before we go on to the next one, I had a couple of things in the chat about Dadpad. Liz, the two Lizzies want to say something about this. Is that true? Do you want to say something about the Dadpad? Do you want to mention?
Oh yeah, sure. So it's just to say that in West Yorkshire and Harrogate, we've funded Dadpad. So we managed to get some money to support perinatal mental health, and as part of that, we've funded the Dadpad app. So it's not free to download for people who live in other areas, but in Leeds certainly it is, at least for this year. And dads who've downloaded it and partners who've downloaded it have said it's a really useful app for them. So it might be great for people to promote it to the people they know.
And my comment was just that I would fully promote Dadpad as well, but there is a version of it available for dads of babies that have been through neonatal care. There's a special version. So it's a minority of dads, I know, but it's out there if it's needed.
That's fantastic. Thank you. We've just actually had a comment in the chat as we've been speaking that it's great, but it's sometimes off-putting for second parents who are not the dads. And so I suppose it's in development, isn't it? Lots of mums, lots of families now feel a bit forgotten in terms of support for that. So it's just balancing it, isn't it? If that person wants to just add a little bit more to that. Oh, and there are paper, Liz says Liz Wigley says there's paper versions too for people who can't use apps as well. Okay, we're just going on to the next question. Thank you. Laura, this is for you and your team. How do you ensure good continuity of care throughout antenatal and postnatal care? Just had a question from the MVP website on that on Facebook, just regarding obviously continuity of care was something that you were rolling out pre-COVID, but now how can we limit the amount of the different midwives that a woman gets to see on her journey in kind of postpartum care?
Thank you, Lucy. Katie's going to take this question. Katie's going to answer this one. Hi, everyone. I'm the team leader for the 5 continuity teams that are currently running in Leeds at the moment. We did have hopes to roll out more by now, but obviously COVID's hit, so that has caused problems with things like staff sickness and staff having to go off and isolate. So those are the sort of challenges that we're finding at the moment. But we are hoping to roll more teams out. they've been working brilliantly. The idea is that you meet a midwife and a particular team that will look after you throughout the antenatal period, and then deliver you on delivery suite, hopefully, the aim is, and then obviously see you postnatally as well. So we are striving for that. It is a national strategy that we're working towards, and in Leeds we're in a really privileged position because, you know, we've got these 5 teams already set up and some more to go in the next coming months. Women are reporting really enjoying being on a continuity team, but like I say, at the moment the challenges that we've got are the situation with staffing and sickness, and unfortunately we're sometimes fighting fires with having to get midwives to replace midwives that are going off sick. That's unfortunate, just COVID restrictions and the effect that it's having. Yeah.
Thank you.
I was just going to add to that, just to say that we know that continuity of care is really, really important. It gives, we know we see increased and improvements in outcomes really with women who do get consistent care antenatally, in labour and postnatally. And even for those women that aren't on one of our 5 teams, like Katie mentioned, antenatal and postnatal continuity is really important and it is a priority. However, with the challenges, what Katie's discussed, that's what we have faced in during the pandemic really. We do aim for everybody to have consistency in a midwife throughout their journey, but unfortunately with staff shielding in the early days and now as well, and staff through track and trace that are going off, and staff unfortunately contracting COVID as well, that then have to go off for a prolonged period of time, and taking out other members of the team as well that then have to go off because of track and trace. So yeah, we are aware it is one of our priorities, but there have been challenges with that as well.
Thank you everybody. The next question, just asking about how are the midwives and health visitors ensuring women and families have enough information on available services to offer face-to-face access when faced with feeding difficulties. So another feeding question to Sally and Suzanne, just about accessing, getting help basically in these times.
It may well actually be better to hear from Amanda and Suzanne as well, purely because they are the services providing this.
Suzanne, do you want to go first and I'll follow up?
Yeah, can do. And I don't know if any of the kind of midwives want to pop in, because this is collaboration.
Absolutely.
For COVID, kind of joint working was a given. There's still always some communication, or people don't know where to find information, but we are offering quite a lot of services still. So I'll start with telling you what our service offers. So we run a service where normally our volunteers are within around 12 of the breastfeeding groups. There's 17 in Leeds across each week, usually before COVID. Now it came and it knocked all of them on the head face to face. So as you can imagine, this is a big blow for us, but our service, they're volunteers, so we cannot ask volunteers to pick up all of what statutory services need to provide as well, because we'd be putting them at risk. And what they have done though is we run a weekly Zoom. Some of you, and I know some of you from the weekly Zoom. So within 2 weeks of the pandemic starting, Leeds Bosom Buddies offered the first virtual support, and we have been offering that ever since. We've not missed a single week. So we're very, very proud to offer that. We responded with a Facebook group closed so that we can offer that. We did events when the restrictions were less over the summer and supported. There were 120 families over 2 weeks came to our events in the park, and for many of them families that were the first face-to-face they'd had with other families too. And just from this, the peer supporters offer a Guiseley group. They offered a Pudsey, but it wasn't taken up, wasn't the provision. Crossgates have just started a virtual group as well, and from just this Tuesday we have started our face first face-to-face again. So Middleton group is reopened, but it's very, very different. It's pre-booking only. By the time we came out on Tuesday, we're already fully booked for this coming Tuesday. So you can imagine the demand is high because, you know, we used to run 17 groups between services. So, but the problem with that basically is space. A lot of these rooms were really small. So when we're looking at safe social distancing, some of these rooms might fit in 2 or 3 families a week, so it wouldn't be a group. Lots of these buildings are still not reopened. We have moved Middleton to a different venue, a different centre in Middleton because it's a bigger room, but we've been lucky enough to do that because Health for All are funding that room for us, and that's who myself and Kath Stone, who I job share with, work for. So that's why we've made progress there, but I'm sure the other services will update you with where they're going. But you know, we're on hand, we're out there, and I do realise not everyone gets told, or not everyone knows where to look or has online facilities and access. So, you know, we're looking to try and meet them need in the best way we can.
And I suppose just to reiterate from a 0 to 19 service perspective, exactly what Suzanne said about collaborative working. So as a service, we are offering one-to-one visits that can be face-to-face in the home. Obviously, our staff are wearing PPE, and what you can expect from a home visit is that our staff member will give you a call before they arrive at the home, just to ask you the COVID screening questions as well. If any, you know, yourself or your family have been well in the past 14 days. But we're also offering a specialist virtual breastfeeding clinic as well, and you can book into that by contacting us. So I suppose I just want to reassure that we are having, you know, we are able to do a full assessment on a one-to-one basis, face-to-face, if that's required. And I just urge people to get in contact with us. So any mums that feel like they need any breastfeeding support on a face-to-face level, you know, there are, from what I've just said and what Suzanne's saying, there are lots of virtual options, and we are offering face-to-face options if that's required as well. And we've actually had quite some positive feedback about, so our virtual clinics are done using a video call, very similar to Zoom, but it's a very secure site. It's a clinical platform that the GPs are using. It's called Accurex, and we've had lots of positive feedback from mums where they've been able to get on the day support by a virtual call with a one-to-one with their health visitor via this method as well, and they found that really, really beneficial as well. And it's a new way of working for our service as well. But in terms of finding information, up-to-date information, like Suzanne was saying, we've got a Facebook page of the 0 to 19 service. You can see it just behind me. And we've also got a website that we update information on our service as well, and our service offer. And you can always get in touch with our SPA, which is our single point of access number. And I've just put that in the chat as well for people to see.
Thank you very much, Amanda, and thank you, everybody. So if you just want to have a quick stretch, and then we'll open it up. Thank you. Thanks to all fantastic professionals as well. It's so lovely to see you're so enthusiastic as well about your services that you represent.
Just on the last question, really, that was it was posed to midwives and to the 0 to 19 service and breastfeeding service. So,
yes, thanks.
I'm going to hand over to Katie and to Nada for this one.
I just wanted to reiterate, you know, that we are providing face-to-face support for those women that have feeding problems, and you know, we will have a telephone conversation, the same as what Amanda was saying with the 0 to 19 service about, you know, if you had any recent symptoms, but we can still do that telephone conversation, and then from that assessment, if a woman needs us to go out because she's having difficulties, that's absolutely not a problem. We have our breastfeeding support workers that are working out in the community that can come out and provide that one-to-one with obviously wearing full PPE. So our services, although we are doing more telephone appointments, we are making those assessments, and a woman is completely you know, free to say that she would prefer to have a visit if we think that's necessary. Our breastfeeding workers will go out and see them, and we're also running our breastfeeding support clinics as well still. So those are on a one-to-one basis, appointment obviously only and that kind of thing, but they are still running. So, you know, just to reiterate really that from a midwifery point of view, we are here and we are here to support you, and we will come out and do face-to-face support should you need it.
Yeah, that's great. Thanks, Katie. And yeah, Nada.
Yeah. Hi. So I'm Nada, I'm one of the Hamler midwives. So in case you don't know about our service, we work with the most vulnerable women in Leeds. So those from BIME backgrounds, especially asylum seekers, refugees, all those who are trafficked, homeless, victims of domestic abuse. So like Katie says, our services are still running face-to-face as well. So we provide the continuity of care antenatally. Intrapartum is coming, and postnatal, if they need any breastfeeding support, then we can either phone them with interpreters, our MSWs help with that as well, and we will go and visit them, yeah, if they need support, again, with telephone interpreters if needed. So yeah, we're always happy to help.
Sorry, unmuting myself. Thank you, Nada. It's really good to hear from the Hamler service, and I work with the Rainbow Hearts Project with Women's Health Matters, and we're project supporting 34 asylum seekers and destitute women at the moment. So we hear a lot about, and I always ask about Hamler. So please, could someone speak about options around home births? I would rather have my partner with me than be in hospital without him, but concerned about the risks of this.
Hi, shall I take this one, Lucy?
Yeah.
It's Laura again. So I think what I would really like to say is that we are so proud that our home birth service has continued throughout this whole pandemic. We have never ever had to terminate our home birth service because of either for staffing reasons, really. So we are really proud of this. So the home birth service has continued, and we are more than willing to support you to birth at home. And I would advise you to please discuss this with your midwife, and she will go through all the options with you. But from a midwife who used to work in community and in teams, and I've done a lot of home births. They are just so beautiful, and we would like nothing more than to support you in your own environment with your own partner there throughout the whole experience. So please discuss this with your midwife, and we will support you in your choices. And I hope that answers your question.
Thank you, Laura. And also there's the home birth support group, which is a Facebook group as well to that person that's asked that question. Laura, just some clarification on what people may be wanting to know. It's just another question. I'm sure it might answer a few people's questions. Why are partners able to attend some scans and departments within the hospital and not others? And also, why are different hospitals following different restrictions? For example, why can some trusts have 2 birth partners and some only have 1?
This is a really good question, and a question that I'm quite heavily involved in the eMidwife Facebook page as well, and I think it's a question that is asked a lot on there, and obviously there is so much anxiety around this, and it's hard to rationalise our restrictions without the understanding really of why they are in place. And I think the easiest answer really is all departments and all hospitals look completely different. And I understand that there's so many frustrations there when, I mean, we're in lockdown now, so you can't go to a coffee shop with your friend, you can't meet your friend in a coffee shop or go shopping with your friend. So when restrictions outside of healthcare were relaxed, it appeared like the words that we were getting from women, they were so frustrated because why is that still in place in hospitals? And I think we have got to ensure the safety of everybody within our hospital. Pregnant women are classed in a vulnerable group as well, and we have varying ranges of vulnerabilities with all our pregnant population. So we need to ensure the safety of our midwives, our patients, our women that are coming through to us, and obviously partners that are coming in. And I think initially, the restrictions were there was nobody coming into the hospital unless they had an appointment with a clinician here in the hospital, and that was national guidance. And then following following on from that, restrictions have been relaxed in a phased approach, and I understand frustrations that why can we allow partners in one area and not allow partners in another area. And some hospitals as well, I'm aware some hospitals are allowed to have 2 birth partners. Again, we have always had the 1 birth partner within our trust. And I think what our footprint of our hospital and our estates are old estates. We have old wards as well. The hospital in particular that is allowing 2 birth partners is a very new unit and is built to be able to accommodate more than 1 birth partner. We unfortunately are not able to accommodate more than 1 birth partner because of social distancing within the room. And again, we are one, if not the busiest maternity unit within the country. So we have a lot of women and pregnant people coming through our service on an hourly basis. So we have to ensure that when they are coming into our unit, using our facilities, sitting in our waiting area, that we can maintain social distancing in our waiting areas. And I think we started with a phased approach on our postnatal wards. It has gone really, really well on the postnatal wards. But again, it is a lot of people that are coming in additional to what is already on the wards. Our antenatal wards look completely different to our postnatal wards. And again, some other hospitals have mixed antenatal and postnatal wards. We don't, because we are so large. We have separate antenatal and postnatal wards. So we can facilitate it on the postnatal wards. Again, just a bit of background, our women that come in, when they are admitted to hospital, so anybody admitted to hospital, it is recommended that they have a test for COVID. So then we can cohort our inpatient population accordingly, so that they are with people who are of a similar, of the same COVID status, really. And I think on delivery suites, everybody has a side room on delivery suite. So that's why we've always been able to have birth partners in, and it's always been recommended that a woman should have somebody with her when she is birthing. She shouldn't be expected to birth alone, and we would never, ever expect anybody to birth alone. I noticed there's a question as well in the chat about maternity assessment centre and what additional support is put in place in maternity assessment. And I think we have had so much positivity and positive feedback from women who have gone through our service. We've done a survey, the MVP have also done a survey, and then we get ad hoc feedback as well from women who've gone through our service. And I think the staff, a lot of the fears that we get from women is that it's a perceived fear, and when they go through our service, the feedback is really, really positive, that yes, they were really, really worried about not being with their partner, but the staff provided an excellent level of support. And I just think anybody who is concerned, please discuss this with your midwives. Please contact us. You can message the midwife page and we can discuss what our plans are moving forward. But I think in response to why it's the estate on there, it's the estate on the wards, they look differently, and that we have to ensure social distancing. We must ensure social distancing because we need to protect our inpatients and our outpatients from COVID when they come in.
Thanks, Laura. Another question as well is another question from someone which you may have already answered in terms of it's interesting that everything is if you need extra support, but as a first-time mum, how do you know if you need extra support? I suppose it's something that you kind of touched upon in terms of like that apprehension and that kind of like, because you've never been through it before. How can you put someone at ease before?
Oh, was struggling with the mute button there. I do apologise. And I think what you need to do is you need to discuss with us, discuss with your midwife, share your feelings and your thoughts, share them with us, and we will do our best to reassure you in that situation. But I think everybody is individual, whether you're on your first pregnancy or second, third, fourth pregnancy. Every pregnancy for every woman is completely different. And we are well aware of this in the hospital, and we are also well aware of the anxieties that at the current time because of the pandemic that we are going through. And I think please discuss it with us, please share it with us, and then we know what you are feeling. We can't read minds, and if people don't discuss with us and aren't open, then we're not aware of that. We understand that the majority of people, if not all people, are extremely anxious and frightened at this time, and we will do our best to support you, but please discuss with us and share with us your thoughts and feelings.
I think as well is knowledge is power as well, so we would recommend to get as much information antenatally as you possibly can from all the sources that we would suggest. We've got, we can signpost you to lots of websites so you can get information, so you can make fully informed decisions about your care, really. So you speak to your midwife, and your midwife will, there's the Leeds Teaching Hospitals website as well. There's loads of information on there with loads of leaflets. Really help. So yeah, just knowledge is power. So get as much information as possible.
I think also you have that, that just the apprehension, but also what there's a lot of questions coming in through mental well-being, mental health well-being. How can we reassure women and families and partners that they can access the support that they need?
And also, what about those who have experienced trauma over the pandemic? At least was a free question and we haven't got to it. What services are still there for those who have experienced trauma, and there has been a high level of trauma through it, and we really need to recognise that and help women. We know that suicide is one of the biggest killer of women within that first year. So how, as a bunch here, how can we kind of update women on that service who may need access to that, or so they can tell the friends how to get that help?
So I think, obviously, I'm very new to the perinatal mental health service, but what I would say is your first part of call would be your midwife, your GP, or your health visitor. Just have a conversation with them, and if you are feeling low or you're feeling suicidal, talk to them, because they will refer to our staff team, and then they will be able to come out and do an assessment, and you will receive that support. So in terms of trauma, we have people trained in lots of different things, EMDR, CBT, lots of things. So there is support out there for all the women in Leeds and York. And yeah, just speak out, ask for that help. Part of my role as a peer support worker is that we have lived experience of sort of mental health difficulties. So with both my pregnancies, I struggled with anxiety, and I'm aware that during this pandemic there is a lot of anxiety for mums at the moment. So in terms of the peer support service as well, if you feel that you would benefit from that, speak to your professionals, your midwives, your GPs, and then obviously we can support you with that.
Thanks, Marie. And also Emily Turner's asked, could midwives ask about mental health every time they see or speak to women, rather than relying on women to bring it up as well? So there are, sorry.
We do, just to go back to that question that somebody's just brought up, we as midwives do ask about mental health and mood and how you're feeling at every appointment. So that's your opportunity then to speak out. And we know that talking is half the problem. So we will ask that question. It is something that we should ask at every appointment. And that then gives you the opportunity to speak up to us if you are having any worries, anxieties, low mood. And we can signpost accordingly as well to different services, the GP, IACT. There's lots and lots and lots of things out there that we can signpost to. But half the problem is just talking about it.
I think as well, what I would say is sometimes we appreciate it's hard to open up as well about feelings. Even when you are asked at every appointment, it is still hard. And obviously having that relationship with your midwife and your caregiver really helps with that, and sharing how you're feeling, and midwives can pick up on that as well if they have a really good relationship, which is why, again, continuity of care is a really, really high up on our agenda. But what I would say, we've also had through the midwife page, like there's that facility to be able to message and to direct message, privately message in that group. And we do have women coming to us through there asking of how we can help them. They're concerned about their mental health, and some of the times when it's not face-to-face, it's some women may find it easier to open up there. So, and we do signpost. That is monitored Monday to Friday, 9 till 3. And yeah, that we have seen questions regarding this and concerns about this that we can signpost on.
Thanks, Laura. And I just want to say that there's been lots of different information being put up into the chat. Thank you for all the resources that we are going to share, and we have the comments that we've got are being read. I'm sorry we won't be able to get through and answer all of them, but they are being considered and they are being read. It wouldn't be a Baby Week without the Right Honourable Hilary Benn, who we've managed to get in to officially close the full working week of Baby Week. And I do realise that you may be on a bit of a tight time frame there, Hilary. So would you like to say a few words and close this? Whether you've picked up any useful information from this Q&A? Obviously, this is the first time we've done it due to the circumstances. But just any thoughts, and thanks for joining us. Yeah, thank you.
Lucy, hi. And hello, everybody. Well, I certainly have learned something, because I've been listening in for about 6 or 7 minutes from having come on from another Zoom call I was doing. And I just wanted to echo the point that Suzanne made about mental health, because this has been a very difficult year, And I know from the very large number of constituents who've been in touch with me, who are dealing with the coronavirus crisis, the impact it's having on their lives, their jobs, their incomes, ability to see their family. This is not something that we expected was going to happen when the 1st of January came around. And I think what you have just been doing, sharing information, talking to each other, it's always good to talk. It's always good to share what's worrying you. And I know as a member of Parliament, I will experience the same thing in my advice surgeries. Unfortunately, face-to-face advice surgeries have not been possible for obvious reasons during coronavirus. But listening and asking what you think may be the right questions is a way of encouraging people to open up. And, you know, the old saying, a trouble shared is a trouble halved, is really, really true. And that's the first stage, to be able to say, I've got a problem, I've got a difficulty, and then knowing where to go. That was the point in the answers that were given really helpfully. And I'm keen to be here because this is the 5th year, and I want to begin by thanking Lucy. Now, some of you may have heard me say this before, and Lucy will have heard me say it every one of the years of Baby Week. But the origin of this is Lucy went on it was a fellowship, a scholarship to Latin America, and came back and came to see me in my surgery and said, I've got this idea. Now, I don't know whether it's my Spanish or my Portuguese is not very good. That's it, Semana de Bebe. She said, which is Baby Week. And I've seen this where I've been spending time. And I think it'd be a jolly good idea if we had a Baby Week here in Leeds. And the reason we are meeting on Zoom this year is because Lucy is a very determined person and built alliances and partnerships. And it's been a fantastic success. And I've come to take part or officially close. How you close a Baby Week up, I've still not worked out after 5 years. It's been a fantastic thing to see. And I want just to thank all of those who've worked so hard. The partnership between the health service, our midwife colleagues who were just talking when I logged on, Leeds City Council, Leeds Best Start, our ambitions to be a child-friendly city. I think it has been a fantastic and wonderful thing, and I wish you all of the success in the years ahead. And the other thing I wanted to say is, for me, and this is a personal reflection, I've been working from home except when in Parliament, and my daughter and her partner and our new granddaughter came to live with us in July because they're going to be buying a home and they're saving up some money. And for me, the thing that has made the last 4 months a joy, because there's been a lot that hasn't been a joy, is having our granddaughter living at home with us. And it's not been a baby week, it's been a baby 4 months. And to see her every day growing and developing, watching her trying to put the movements together to crawl, and you could see it. And you know, you haven't quite got them in the right order. Now, of course, she's zooming round the room at great speed, and it won't be too long before she is standing. And it's, my wife and I often say to each other, it's been the real bright spot of what has been a very difficult time, because being unable to see other loved ones, other family members, grandchildren, and I think particularly of those who've got loved ones in care homes, in hospital, this has been really, really difficult, which is why as a city and as a nation, we need to do the right things to try and defeat this virus. The news about the vaccine was really good. We're all looking now at Pfizer, BioNTech, the MHRA, who have got to certify it for use in the UK. But we've said for so long that we're only really going to be able to come out the other side of this when we do have a vaccine. And if it is as effective as Pfizer thinks it is, then that is something to look forward for the year ahead. But it's going to continue to be difficult for some time. And I just wanted, as well as thanking all of you in all of the different roles that you perform, for the work you do when we didn't have coronavirus and what you've been doing while we've had coronavirus. All of the people that you support, give advice to, advise and counsel, are immensely grateful for what you do, and I am too. And once again, I want to thank all of you for participating in Baby Week, and to thank you, Lucy, for what you've done, and also to thank Sadia for everything that you have done as well, because it wouldn't be Baby Week without you too. So I don't know how you conclude an event, because there isn't a curtain to unveil. I don't know whether one draws a curtain over it and says Baby Week is now ended, but I wish you all the best.
Thank you very much, Hilary. Yeah, it's still going. We've got the Yorkshire Sling Library, West Yorkshire Sling Library at 2:30, which is on a live event on our Facebook.
Ah, right, great.
Yeah, so and tomorrow as well, there's still sessions, taster sessions, and Leeds Dads finishes with an event on Sunday where we announced a prize draw that we've been able to collect together as a thanks from our partners and to everybody who's joined in. So we might not be face to face, but definitely Sadia has risen to the occasion with being very creative, and yeah, her vision has just every year just astounds me, and definitely a co-parent to the Baby Week. It was a lovely well okay, the other parent, definitely the mum, Hilary. It was nice to hear your personal experience as well. That's really good. It's always nice. And Baby Week Bradford, who in their 3rd week did a great grandparents session yesterday.
Thank you first for joining us, and all the trustees and all the members, especially Liz and Sally, that are in the conversation from obviously the health representative. That we have decided to align some of our ambitions for Baby Week with the United Sustainable Development Goals, and one of them being climate emergency. So hopefully, obviously after this lockdown, we are launching the first ever Baby Week forest, and hoping to plant a tree for every baby born in the year. So we've done some planting with schools earlier this year, and we're going to wait for Laura and the LTHT midwives to give us a final number on the 1st of January. So we'll definitely invite everyone that's been on the call today, and we'll set up a series of days for volunteering and planting with us, and hopefully get the parents and carers and expectant parents to come and design with us a little board that could be of memory of the 2020 Baby Week Forest, and hope to do that as an annual thing of planting a tree for every baby born.
Oh, what a fantastic idea. And look, when this is over, I'm quite handy with a spade, so if you'd like to invite me to come and join some tree planting, I'd look forward to it.
Yeah.
I wish you all the best. Will you forgive me if I have to leave now?
Thank you.
Okay. Cheers. Thank you. Cheers. Bye.
Not at all. Take care. Thank you. Bye.
Cheers.
Okay, everybody. Thank you so much for attending this final this webinar, final big events of the full working week of Baby Week. Like I said, it's still continuing. Check out our Facebook, check out our website, all the things that Sadia has just been talking about. Thank you to all our trustees and all our partners that have made this happen. I hope it will continue, and we'll carry on like this. Who knows, we might have more of these little webinar events now that we've mastered it, and we'll all become experts on this digitally. So if the speakers would like to remain, and if we say thank you, and that would be an end to the to the webinar in terms of the other participants. We will keep all your comments in on record, and we will hope to be looking at these in the future and seeing ways forward in how we can collectively respond to this, especially in these times. Sadia, would you like to say anything?
Yeah, just that we will, I know quite a few people messaged me privately and we didn't get through to all of them. So we will go through with the speakers any other questions in their own time, because I know people have to rush off, and publish them on the website, which is www.babyweek.co.uk. And thank you.
Thanks.